So this is the GHA's intensive care unit, and we've come to speak to some of the individuals leading the GHA's effort to deal with COVID-19, certainly with those individuals who become worst affected by it and need intensive care.
So this is the current intensive care unit. This will be deemed the COVID positive intensive care unit. So as of this point onwards, it will be declared a dirty area or COVID positive area. So you'd have to don your full personal protective equipment before walking through here. With all your equipment on, you'll come straight through and into the intensive care unit where all our staff will be wearing full equipment for your entire shift, or at least there's a large chunk of it. And then on your way out, you'd come through on this side, come into this bathroom with the help of the buddy, remove all your personal protective equipment before coming out, making sure you're fully washed and entirely clear of any coronavirus that you might have on you, and then come through here again, wash yourself all over again, and then make your way to the rest of the department. But everything beyond that point will be deemed dirty, and everything beyond this point will be deemed clean.
And to state the obvious, why is that so important?
So one of the biggest problems with coronavirus is that it's very easy to spread the infection after dealing with patients. So once you go into a dirty area or you've dealt with a patient, you're likely to have tiny droplets all over you, and the best way to avoid yourself being contaminated is to make sure that those micro droplets don't end up in your mouth or any mucous membranes. So you have to make sure that you've been completely cleared of the virus. The main way we do that is by using personal protective equipment, so masks, gloves, gowns, etc. It's very easy, if it's not done properly, to, for example, when removing your mask, touch parts of your face, or removing your gown, touch part of your scrubs, which later on in the day, if you then touch and then eat or scratch your eye or something, self-contaminate, in which case you would then fall victim to COVID-19 later on. The main problem is that because you can be coronavirus positive for up to 14 days without showing any symptoms, you could go on to spread the infection to other people. In healthcare, that's a particular problem because, of course, we work so closely together that if you did have the virus, you'd be able to spread it to large parts of the team, which means that over the course of a couple of days, you could essentially wipe out the entire intensive care team. So that's why we spend so long training our staff in making sure you do it absolutely meticulously to avoid that from happening.
Confident then ahead of the surge that you guys have that protocol down to a T?
I think we are absolutely confident. A lot of time and effort has gone in to making sure our staff are aware of the meticulousness, the importance of doing it absolutely perfectly to avoid that happening. And I know that we've been doing this for many weeks now, so we're as confident as we possibly could be. And once we start to get the patients in and get more and more practice, we'll be even better still. So we've increased our ventilator capacity by over 500%. So this is a standard isolation pod showing one of our intensive care beds. So here you have state-of-the-art monitoring equipment which will be able to monitor patients' heart rate, blood pressure, oxygen saturations, carbon dioxide, etc, etc, etc. And then that will be connected obviously to the patient. And then here we've got one of our state-of-the-art ventilators, which will be able to help patients with their breathing, or when they're very, very sick, do all their breathing for them. And again, this will be able to monitor 101 different variables, all of which will be very boring to everyone other than intensivists. And then obviously a patient will be here, and they'll be able to manage all sorts of things, whether it's electrolytes, minerals, be able to give blood pressure, increasing medications when we're very sick, our blood pressure tends to drop, as well as many other medications, fluids, etc, etc. This is, as I said, the existing intensive care unit, so it's not a brand new intensive care unit, but we've certainly kitted it out, increasing ventilator capacity on this unit from 5 to 13, and then we've opened up the new unit where DSU used to be, with the rest of the ventilators going there. The plan thereafter, if needs be, would be to fill up that unit with COVID positive patients, and then later on start to use our anaesthetic rooms and theatres to accommodate even more ventilator patients. A lot of the equipment you can see behind me is just part and parcel of gearing up those ventilators and gearing up all all that extra capacity that we're going to have, but certainly once we deem this a dirty unit, we start to get patients, all this will be completely cleared, so that once we get patients in and out, our fantastic cleaning staff can then follow us and make sure everything's been decontaminated along the way. So I think it's very important that the people of Gibraltar take this seriously. I think it's important that people realise that we have to do absolutely everything possible to flatten the curve, to make it easier for us to look after you. Nonetheless, the most important thing I'd like to say now is congratulations to the staff of the GHA who have done absolutely fantastically in preparing this and increasing capacity to a level which you are unlikely to see in the rest of Europe. I think we can be very proud of our staff and very proud of the people looking after us. And we just ask you to help us to look after you. Stay at home, wash your hands, do all the sensible things, but do them properly. And should you need to be looked after by us, it'd be a privilege to be there for you when you need us most.
Dr. Garcia, on behalf of our viewers, many thanks for the work that you've done so far and the work that you will be doing.
Absolute privilege, thank you.